Well, the designation of October as Breast Cancer Awareness Month in South Africa is a drive by or rather private healthcare structures to raise awareness of this disease. The incidence of breast cancer in South Africa is increasing and is one of the most common issues affecting women across classes and races. And although breast cancer is rare among men, it does occur. I'm joined in studio now by Addie Lang as well as David Solomon, co-founders of Forever Changed Global Awareness Campaign, as well as Dr. Karel van Eerden, who is a male breast cancer survivor. And I've butchered your surname. My apologies for that, Karen. Thank you so much for your time tonight. Tell me about the period at which you actually were diagnosed with breast cancer. Did you believe it at that time?
It was quite difficult to believe. I mean, we don't think that men get breast cancer, and the lump was there, and you can't go for a mammogram. So I went for a test called a thermogram, in which they said, well, there is a cyst or a lump that needed to come out. So you then go to the surgeon who does a biopsy. It is one of the most painful procedures that a man can go through, especially for men, to have the needle put through your nipple. Yet it has to be done.
Yeah.
And yeah, I was extremely lucky in the sense that we caught it very, very early. So we could just cut it out and take it from there.
And I mean, the importance of early detection is very important. Yes. Important, like you really reiterated there. But it doesn't seem to be the case when it comes to men. It's very hard for them to spot, you know, the changes, or spot whatever it is that, or pain, or any physical change or damage that they might be feeling, you know. What do you think it is exacerbated by? Maybe a kind of perception that breast cancer is only a disease that affects women, not necessarily men?
Most definitely. Everybody thinks that it's a hormonal thing, which it usually is. And the challenge comes into the fact that men have estrogen, and we don't know that. It's the hormone of cognition. So we do have estrogen, and unfortunately, a lot of women are on the pill today, and they urinate estrogen-laden urine.
Yeah.
We drink that water. So we get more and more environmental toxicity, and because of this environmental problems that we have, we then sit with the challenge that we then have more and more cancer caused by hormone imbalances in men.
That's very interesting. Let me bring into the conversation Addie Lang as well as David Solomon, co-founders of Forever Changed Global Awareness Campaign. What compelled you guys to actually start this campaign? I'll start with you.
So when I was diagnosed with breast cancer in 2014, I felt the need to tell people what was happening. People cope emotionally differently. Obviously, some people are very private about it. I felt that it's a story that needs to be told, and coming from the TV and film industry, I had a platform. So the campaign has grown over the last 5 years quite enormously. And I'm the founder, but we now have a board, and we're reaching greater heights.
And tell me about those heights, David. I mean, what's the core role of the campaign itself? Is it to interact with possibly survivors of breast cancer? Is it to cushion the blow on those who have just been diagnosed? What would you say is the core role of the campaign?
Yeah, all the above. We interact with survivors. We transmit information, latest information, which is factual. We go to international conferences. We learn the latest technologies, and we make available information to make the patient make his own choice or her choice, which way to go. The new discoveries are all factually based, all proof-based, and there's a lot of change in the world, how to treat the far better technology, very advanced, dramatically higher survival rate. This is a
David's a chemical engineer and a scientist, so his side was to look at the campaign and bring in education, bring in research, bring in a science mind, because for me, I was going through the emotion of things. So we've also developed corporate training where David talks about the science of nutrition and the benefits of what to eat and what not to eat as a cancer survivor. The oncologists don't seem to tell you that at the time. And our training program is called Live Life Deliberately. We're accredited by the SA Board for People Practices. And we're reaching the corporate sector more than the public sector at this point in time.
I mean, we know that the chest is almost the first area in which it gives us the sign of breast cancer in males, for example, and most often it's found behind the nipple, and that's what many doctors say. But what are the other warning signs that men can look out for?
It could be discomfort as well and pain that you would have in the chest area. Things like tiredness, unexplained tiredness is a big thing. And then, of course, the cyst itself or the mass itself, it is something that you will feel at some stage. And those are the main things to look out for.
And would you say those are, in a sense, I mean, you mentioned earlier on, Carol, that they are not screened the same, you know, men and women. But are they, in a sense, treated the same too as well, David?
the different technology. Every case is unique. As far as women are concerned, there are new technologies which treating it directly, and the main is a different protocol, but basically it's the same purpose, same target.
And let's talk about the emotion behind it, because I'm sure, Addie, you deal with men who have been diagnosed with breast cancer. What can you tell us about how men generally take the news as opposed to women do?
Okay, so for men and women, cancer is cancer. The diagnosis is life-changing. That moment that you hear the word, you have cancer, cancer knows no boundaries, no age, no race. Cancer does not discriminate. That's what we're trying to say. It really is public knowledge that men and women get cancer. Carl will tell you that not many people are aware of the men getting breast cancer, but in the global forum, men and women and children, doesn't matter how rich or famous, it doesn't matter who you are, cancer knows no boundaries. So it's very important to get beyond a pink ribbon campaign, especially during Breast Cancer Awareness Month. We're way past that. We need education, we need information. Our people are perishing due to lack of information.
Right.
If I look back over the last 5 years, what I didn't know were the dangers, the pitfalls. The doctors don't seem to tell you that at the time. And I must be honest, I negated taking responsibility. The diagnosis was so traumatic that I went into an absolute frozen bubble. I feel like I'm only coming out of the bubble 5 years later. It's very important that patients, men or women, whether it's your children, whether it's yourself, take responsibility to become part of the medical team. I'm not saying from a medical knowledge point of view.
Yeah.
I'm saying I sat back and said, I can't cope with it. Let me listen to what the doctors were saying. And I followed like a sheep. I had a mastectomy, I had chemotherapy, I had breast implants. All of these things, in hindsight, it was not the only way to cope with a diagnosis of breast cancer. And I'm very outspoken and very controversial in the way that doctors are happy to tell you about have surgery, shrink the tumor, have chemotherapy, have radiation, go on to tamoxifen for 5 years, boom, bam, finished.
Yeah.
It never
What
ends.
should they be doing then? What should they be doing then?
Well, I'm not
how
a
do you
medical
think
doctor.
they should have?
So,
I'm sure you've researched your case.
Yes, of course I
How
have.
differently do you think they should
Okay.
have dealt
so
with your
my
case specifically?
story started where I had been to the doctor with pain in my back, my upper and lower back, beside feeling a breast mass. for 18 months. I went to the GP. I kept going back. The GP said, it's nothing, don't worry. And the long and the short of how and why the campaign started was about medical negligence.
Yeah.
It's changed completely. It's not about me. It's about how the world sees cancer and the changes that South Africa is forced to look at because of global changes.
Karen, how do you think South Africa views breast cancer, as she has mentioned? I mean, it seems as if we have this full-on campaign for a month and we actually forget about it, where, for example, men are out in the cold. They're not being brought into the discussion about what breast cancer is and the fact that men actually can be affected by it. But what is it that we are possibly doing wrong, especially during this time?
So after my cancer was taken out, I joined a medical practice in the sense to help people with specifically these questions on the counseling side, to help people through that area of fear, because it's a fear that you cannot describe to anybody. And what we are doing is we are trying to educate doctors in how not to get cancer. When we do our training, the lecturer always says the best treatment for cancer is never to get it. So we are looking a lot into things like lifestyle management. When people come to us, we have our support groups where we tell people how to eat, and that it's not the same for everybody. Every person's journey, for lack of a better word, is unique. So if you, unfortunately, this is an expensive exercise, but if you can check your genetics. I did my genetics afterwards and I saw I have a predisposition. And now that I know that, through my lifestyle, I can mitigate that risk. So specific foods I shouldn't eat, or just upregulation of specific detoxification pathways of my liver. Those things are really important to know. If you cannot do that, then you look at your family history and you start seeing the patterns there and you work with those patterns. The big thing for me is start with your food. Food is medicine. It's not just something that you ingest. And it's not just there to make you full.
And I really want to delve deep into that when we continue after the break. We are in conversation with Addie Lang as well as David Solomon, who is the co-founders of the Forever Changed Global Awareness Campaign, but also getting a personal male perspective from Dr. Carol van Eerden. We are talking, of course, a male, just generally talking about breast cancer and how it also affects males. So that and more when we return. You're still watching the PM edition of, or rather still watching Weekend Prime right here on Newsroom Africa, channel 405. Stay with us. You live on Weekend Prime on Newsroom Africa, channel 405. We continue our discussion about breast cancer during this Breast Cancer Awareness Month. I am in conversation with Addie Lang and David Solomon, who are both co-founders of Forever Changed Global Awareness Campaign, as well as Dr. Carol van Eerden, who is a male breast cancer survivor. Thank you so much again for your time. I want to touch on the important issue, David, of how we can give support to our employees or maybe even colleagues who have found out that they are diagnosed with breast cancer. How can we create an environment, especially in the workplace, where they're given that support?
Yes. Well, the biggest deficit that I see is information. There is not enough information given to employees. That's why we are giving a corporate talk from time to time. And that's what the biggest deficit that we have here. Giving the information is what is the latest development, what is alternative, what is a proof of the alternative, what's happening in the world. There are people simply do not familiar with that. And therefore, they haven't got enough information to make intelligent decision what to do. Once you have all this information, it's much easier to see the way forward.
Do you think that, sure, you can
Now,
continue.
one of the biggest problem is what to do, because people believe to any doctor. However, the latest development, as we've seen overseas, we came back for a conference a week ago, and the latest development is showing that there's a complete revolution what's happening in the market. And survival rate is dramatically increased. And we haven't got that presented in South Africa yet. That's what we're trying to do.
So it's also about educating the HR department,
Yep.
managers, CEOs, C-suite level, to understand what to say, what not to say to somebody that's come back to work, that's just been diagnosed or just come back from treatment. There are many corporates that are doing really good work in terms of HR and managing cases. There are also companies that are not doing enough.
And that was my next question about
Yeah.
whether or not we have corporates or even companies who are willing to create a workplace culture that supports employees undergoing treatment.
There are companies. One of our biggest companies, as a good standard example, is Mediacom. They've been outstanding in the growth and journey of the Forever Change campaign, particularly on the HR side. They did have people in the company. They managed it very well. We've had other people approach us who went back to work. Their bosses fired them instantly. We've got a case where somebody was fired while they were still in hospital. These are cases that are going to the CCMA and are going to Labour Court. But beside that, we're encouraging HR to say there's an elephant in the room. It's not going away. Cancer deserves in the workplace the same respect or equal respect that HIV has had. And that's essentially, we lobbyists, we advocates, we want to see companies doing more. So we welcome, we invite corporates to approach us so that we can actually relook at policies and do more for the working people.
Carl, is this something that you experienced as well when you received your diagnosis and also undergoing treatment? You know, that relationship with your employer, was that at all, you know, prevented or trampled upon as a result of your condition?
Not at all. I was lucky enough to actually have started work at a medical practice right before that happened. And so I was actually held in the safe cocoon throughout the whole journey. I was also lucky enough that the practitioners that I worked with are very open on options in cancer therapies. So it wasn't the standard 2-3 options that we had. So we could really look into the differences, and they gave me the time to heal, which I needed.
I mean, there seems like there are certainly other approaches based on the research that you have been referring to as well, David. Why is it that you think that we're not really open to it? Is it because, and where is the pushback actually really coming from? Is it from the doctors?
Can I just say, David, as a scientist, has researched the benefits of cryoablation. It's about freezing the cancer tumor cells. The rest of the world is using it commercially as a treatment. It's been available for the last, since 2012, this particular one that we're talking about. But cryoablation has been around for 20, 30 years. We're saying to South African doctors, why did we attend a medical conference where we were the only South Africans there? And the rest of the world is very far ahead with cryoablation. David, if you can explain a little more about what cryoablation is.
Yeah, cryoablation is simply freezing the tumor. Let's say breast cancer. It's also used in kidney, liver, and lung. Freezing the tumor by using a liquid nitrogen probe. You see it on the screen, depending on morphology and the position of the globe, you freeze it and it cracks to pieces. It doesn't damage anything else, and there's no surgery, no cosmetic, no pain, no medicine. And after half an hour, the woman can go back to work. There's not even a bad time.
There are some doctors that are starting to use cryoablation, but the point that we're saying is that they're not advancing fast enough to what the rest of the world is doing.
Okay. So what I would like to say, we've seen this hardware, we see the operator, we're trained on this, and I'm not a medical doctor, but very much familiar how this is work. It's been done in the conference. And this is a very, very powerful weapon. Now, it's approved by the FDA. We released last year in press conference here the trial and FDA approval. The success rate on this one is above 99%.
So certainly there are other options out there,
Absolutely.
definitely. I'd like to bring it back to the topic at hand here, and Karel, and just for you to give us, a word of advice to men who have recently heard news that they were diagnosed. How would you advise them?
Firstly, find a group of people to support you through this, either through the practice that you are going for your therapy, or make contact with groups like the ones that we have, the Kick Cancer Campaign, the Cancer Awareness, and find people that will educate you. Take charge of this whole thing. It is not good enough for you to stick out your arm and say, "Doctor, make me better."
Exactly.
You can't do that anymore. You are supposed to be making the decisions based on the information that you are given by your medical team.
I'm
So-
sure you also appreciate the anxiety that takes over, especially during that time. Although, you are really highlighting an important part about being a part of, the conversations with the doctors and experts and so forth. How do you do that, especially when you're facing the biggest decision and illness in your life?
So, again, I can just refer to the practice that I'm working in at the moment. We do not just have a medical team. So for me, after this whole journey, I did a counseling PhD so that I can help people. And what happens if somebody comes for their first consultation after their diagnosis, we are two people in that room seeing the patient and their family. It is the medical doctor, and then I come from the counseling side because we need to bring the two together. So we work a lot on that as well. It is not a separate facility. If you do not have that in your medical team or your healing team for that matter, then get somebody who will help you with that, and also maybe somebody who understands.
Yeah, definitely. Right, let's leave it there. That was Dr. Karel van Eerden, who is a male breast cancer survivor. We were also joined in studio by Addie Lang, as well as David Solomon, who are co-founders of Forever Changed Global Awareness Campaign. Thank you so much for your time this evening, and especially for the work that you do. We must certainly hope that you'll be able to do even more by empowering people with the information that they need.
Thank
All right, let's leave it there.